Welcome to the Chasing Your Dreams podcast, a place for you to find the wisdom and powerful strategies for overcoming obstacles and making your dreams come true. Here is your host, Eric Hall.
Welcome back to the Chasing Your Dreams podcast. Today is an honor. I have one of my best friends, one of my Trojan classmates that graduated from the University of Southern California with me. We're going to be having a great conversation here today. Please like, follow, subscribe, anything you can do to continue to help the channel grow. Today I want to introduce the world of Dr. Carmelita Bigelow. And without further ado, Ms. Bigelow, tell them who you are.
Well, is it good morning, good afternoon, good day, everyone? I am Dr. Carmelita Bigelow, a psychologist. Graduated as a Trojan, like Mr. Hall said. We both graduated as USC alumni. I own Painting Miracles Incorporated, which is a multi-specialty behavioral health and clinic here in Fayetteville, North Carolina. What else, Mr. Hall, do you want me to talk about?
Well, today, man, we're going to talk about a lot of things. Soon we'll be having a show that'll lunch together that we look forward to. And, man, a couple of things brought us together while we was in school. One of those things, actually, man, this month has been a month where I've been having an opportunity to do this presentation about, just coping with grief during the holidays. And it was interesting enough that we got partnered up in class and, ultimately I started learning some of your backstory, man. Yeah. About you kind of losing your whole family and things to that. Mm-hmm. So today, man, we're going to talk through some of this together.
Sure.
And I'm going to let them know kind of how you've been able to overcome adversity even in this season that we're about to go through. Mm-hmm. And I want everybody to just know how they can support you and then us together as we do some things together. But in terms of just that topic alone, just coping with grief, what does that mean to you?
Well, as you already know, I am a familiar suicide survivor. What does that mean? I have lost my entire family, my mother, my father, and my only sister to murder-suicide. It was a very difficult time. The way I have put my grieving and bereavement process was through school. Actually, my entire PhD program was done pretty much and completed through my bereavement process.
Absolutely. And then, I meet you, you kind of tell that story, we end up breaking down, and then I share as well. I lost my father when I was young. I pretty much just lost an uncle. I had been through so many different things over the course of the years that it was just interesting. I don't even know, the opportunity that, both of us would end up at the University of Southern California. We both would end up in Fayetteville. So in terms of, ultimately going through that journey, man, before all of that happened, what was life like for Carmelita?
Well, life was great. I had an awesome family. We were very close-knit family, Pacific Islanders. And I grew up in the Bay Area, Oakland, California. And so everything was awesome at the time. I did move to North Carolina back in probably around 2005. And of course, I had lost my family, interestingly enough, on Veterans Day, 2011. So every Veterans Day, of course, is a sense of trigger for me. But before then, I have my degree in nutrition and dietetics. So I did some nutritionist. I was also a personal trainer, if you can imagine, at the time, and started my nonprofit organization called FAMCASTLE, Fitness and Nutrition Coalition Against Sedentary Living. And I have that in place and continue to explore that journey since 2008.
Okay. And since we already got it, I think we would today. How do people find out more about, nutrition information through you? Like, how do they get the help that they would need?
Well, right now we don't have that time. We are focusing on our journey when it comes to behavioral health and helping people. We got to point of in this lifetime where we have the opportunity to have a focused life. And that is what we're talking about, chasing dreams and being able to turn possibly a negative experience or trauma into more of a productive and abundance, pretty much as God have promised us, right?
Absolutely. And Now you set yourself up for a huge testimony here then. If you want to say it in that way, I mean, honestly, you was able to really overcome that tough situation in your life of losing your family, and then you mentioned going through school was a part of basically your healing process.
Yes.
What some other things even after that you've been able to accomplish, and even before we go down the lines of what the ultimate goals were as you were growing up, how has that changed over time?
Well, my family is a military family. I was, married into a military family as well. My sister, my brother-in-law, who took the lives of my mother, my father, and my sister, was a wonderful person. I can never even say a negative thing about him. He loved my mother, my father, and my sister. It's just that the trauma of PTSD. And as we know, there is that certain level of not understanding fully what PTSD is all about, especially in the military community. And for me, as being in the midst of that, I have witnessed myself what PTSD can do. And as wonderful as my brother-in-law was, he had PTSD, and ultimately that led him to commit what he did. I don't think it was something that he intentionally have done, but certainly when a person is going through trauma, it's possible. Anything is possible.
Absolutely. My PTSD, she's definitely talking about post-traumatic stress disorder.
Mm-hmm.
And, on the flip side of that, I now know that, through your journey in school, you became more educated on a diagnosis such as this.
Mm-hmm.
What is something now, you actually, as you work with this population, what are you trying to accomplish and get them to understand?
Well, one thing that I would like to, and both of us, we have the specialty on. For me, I took the specialty in military family and culture. And it's really different from what they consider a civilian, outside the military experience. And the thing is, they military are conditioned to do certain things while they are serving. And once they are out of the military, they go through a process that it might not be quite as familiar as we are when it comes to being in a more normalized community, if that makes any sense.
Absolutely. And when we started working together, we actually just spent a lot of time talking about like that military population, what we specialize in,
Mm-hmm.
and how we can best, get our hands around that population and understand. We both ended up going through having TRICARE. We both see military patients now on a regular basis.
Right.
Through your journey, man, we see kind of where it's ended up now. What was your goals when you was growing up? What was Carmelita growing up? What did you enjoy doing?
Honestly, I was into sports. I was really singing, dancing. I mean, there's a lot of things that I was really into. Having a Polynesian family, luau and all of that is one of those things that is always, introduced to you at an early age. I was a Girl Scout, at that time. And as I have grown, of course, in a military household, you get to understand the dynamics of not having two parents at times in the home when one is deployed. So all of those things are a part of my growth process. And as at the time that I lost my family, it was a transition for sure. And for me, even in that, Mr. Hall was saying regarding testimony, I even said to myself, where is God? I've never done anything in my life that would suggest, hey, I deserve this. But in the process, what is God, directing me at that point? So having Painting Miracles is actually, I would say, a divine intervention in my life. And what I mean by that is when Painting Miracles came about, and in the clinician, just to kind of give you a background, in the clinical setting, we have this process what we call a miracle question, right? What would happen, in your mind if you go to sleep tonight and you wake up tomorrow morning, it would be the perfect ideal situation for you. What would that be like? paint a picture for me. And so that is Painting Miracles. That's how Painting Miracles came about. So from my early beginnings to now, it's always been family oriented. So even in Painting Miracles, in our behavioral health in clinic, family first. What that means is that we take care of our patients, but we also have to take care of our clinicians.
Absolutely. And what services do you provide through Painting Miracles?
Oh gosh, do you really want me to list all of that? Because it's so much, including this podcast, right?
I want them to understand exactly everything you have to offer.
So, of course, we have our psychotherapy. We also have medication management, because we want to make sure we are putting our patient in the right medication. Because a lot of times, if you have what we found out in several behavioral health clinics is that you either focus on one area, whether it's mental health, behavioral health, psychological testing. So you go through these different clinicians. So with Painting Miracles, Inc., we incorporated everything in one building. What that means is that we provide medication management. We even have ESA, emotional support animal. So we register the animal. We give you the license to as part of the Disability Act to make sure that you don't have to pay extra money to pay for your apartment to have an animal, an emotional animal that can help you with your anxieties, your panic attacks. So those are important. So we provide that. We also provide good parenting classes for our reunification program that is mandated by the court system when they reunified a family, when the children are taken away for any reason. We do provide that mandated, certified, good parenting class. What else? We do bereavement classes, anger management classes. We do a lot of things. What else did I make?
Keep going. You do.
There's so much, and of course, we now have this collaboration of podcasts coming up. So, I'm really focusing on that more. So, why don't you talk about that?
So, we've been partnering up for a while. Actually, we was in the process of partnering up. Even before I even started this channel, we had been in talks to kind of work together, just to kind of bring people to kind of understand our journeys, but more so understand that it's okay to go through things in life, and you can still be successful. I talked about specifically, this week and last week, I've been on the journey of traveling to kind of just talk about coping with grief during the holidays to many different populations. And for us, man, we're two individuals that had to actually utilize the majority of the skills that I'm actually presenting and talking about. Not only because, man, anytime like a sudden death or death just happens in general in anybody's life, there's multiple ways that this can play out, because the loss, it creates a void that sometimes you just can't feel. Right. And you have people that falls on both ends of the spectrum. You have a lot of people that goes on to be successful. Mm-hmm. And then you have those that get down, depressed, and kind of fall off the hinges. We're trying to promote, people understanding like it's okay to overcome that adversity, right, to let's go ahead and be successful. And then the primary thing that I even talked about in that presentation, it's okay, man, to miss that person. Two things can be true. We can miss that individual that's gone, but we also can still enjoy these holidays that are coming up, right? Mm-hmm. The first thing that I'm always talking about is just like with any recovery process, right? Is just acknowledging the difficulty that's going to take place when those days are coming. Like you mentioned, Veterans Day, in anticipation of that, we know it's going to be a tough day because you've been through it routinely, right? Right. And part of what I'm educating on is, okay, let's not avoid that day. Let's figure out how to put things in place so that you're not as miserable. Let's figure out a way to honor their memory. Let's do something different. Let's change it up. Why is that important? Mm-hmm. Because if you're still living, granted, no accident, no tragic disease, anything like that, that same date gonna come around next year. Right. And it's gonna come around again the year after that. So just having a constant message that we got to get up and go. We got to put things in place, and then being fully transparent. I spoke a lot about losing my dad over the past few weeks, but even after losing my grandmother, I was able to share that presentation that, I went through some of that myself. Mm-hmm. And because of what we do now, being more educated and understanding, I knew I was off. I knew I was depressed. I knew I was down. Why? Because I didn't have my same energy. I felt fatigued. I was wore out. I just couldn't get nothing done. And I'm one that always on the go and can complete my work. So I had to really practice what we're talking about doing. So I really believe in what we do, because I really went through it myself, and I had to overcome, those feelings and thoughts. and really try to get myself back on track. You know, that whole thing of like, it ain't just simple as just snap out of it. Like, what do we do to snap out of it? There's many different things we can do. Which me here, Hub started showing my podcast. We're here today. I mean, working out, really trying to work out at least 20 minutes a day just changes and improves your mood.
And your support system.
Absolutely.
Your support system.
Communication, networking, friends, that's what we're doing now, like working with others, man. You know, that's very important.
Because it's easy to isolate yourself on those days. And believe me, I've been there. But what I have realized is that how can I turn this into a positive experience each time? Not just remembering them or remembering the tragic, but how can you turn around and make it a positive experience instead? That's easier said than done, but it can be done. And that's what we want. That's what we want to convey to you out there today, is that there is a positive way of looking at things. You know, we can ask ourselves, why did it happen? But why not ask ourselves, now that I am in this season of my life, what can I do to better it? And to even, you know, share my testimony so others can also understand and have that support in that time. Yeah. Absolutely.
And I mean, other tips, don't use drugs and alcohol, man. Like, alcohol itself is a depressant. So it gets used for the wrong reason. Like, you start to believe that it's improving your mood, but it has the opposite effect. It's a depressant. So the more that you drinking and things of that nature, now you slip into a whole nother side of being depressed, which now you have to worry about what? Those signs of like being hopeless, you know, down, irritable.
Right.
Suicidal ideation comes to mind, right? You know,
absolutely.
That's when those symptoms really creep in at its worst to worst. You know, not only just when somebody's in a state of just being post-traumatic stress disorder, but those are things we have to worry about in general. When, you know, we've been through things, because it's easy to fall off the tracks, as I mentioned.
Yeah.
I mean, one thing that we talk about in doing this, though, is about what we do in treatment in general. We plan, we put things into place to start to help us get over these things, right? And the reason
be accountable. Be accountable. Yeah.
Absolutely. We don't wing it. We don't just wing it. We put things in place that you can really measure yourself by. Like, strategically, you want to have goals and expectations that you can say, okay, this is what I'm chasing. The premise of behind the Chasing Your Dreams podcast, like, what are we going after? And it doesn't necessarily mean you're going to always reach that goal, but you're going to end up in a better place. Why? Because you chased it. And at the end of the day, you have the checks and balances that Ms. Carmelita just spoke on. Like, where did we come up short? Like, let's analyze it and put a plan in place to overcome it.
Right.
Well, with Ms. Bigelow, you see, we playing off of each other now because this is our realm. In terms of what we want people to understand in the sense of their journey, and understand there's people just out here like them, not even just amongst like tragic situations, like, but it's also times where in our lives where we've had to go through hard times. Nothing was given to us. We had to get to work, and part of what we had to do was pull ourselves out of places that just wasn't conducive to where we were going.
Right.
So let's talk about that, because I know we both had to kind of separate ourselves, whether it was friends, situations, whatever the case may be. Let's talk about that.
Okay. Where do you want to start?
Let's start with just friends.
Friends. In regards to growth. Okay. Well, friendship, growth, you know, whatever your dreams are or what you're trying to accomplish, it is important that you have your support system, like I said earlier. And so putting the right people in place, as they say, as you get successful, sometimes you lose people. But what does that really mean? Is it really losing people, or is it improving yourself in a sense of growth, as we are talking about? So when you get into a focused life, you tend to lose people that's no longer going to be able to understand you. And that's okay. That's okay to have. You just, again, thinking positive, moving forward, whatever trauma or situation or circumstances that you went through, there's always a better way. Is that a good start?
Absolutely, it is. And, you know, really understanding that everybody just don't have the same dreams, the same goals and aspirations. And sometimes to grow, you got to get outside your comfort zone, right? Like, you got to reach out to those people that's doing some of the things that you want to do. So
and inspire people at the same time.
Absolutely.
Yeah.
I wanted to start a mental health practice. I had to go find people that had mental health practices. It wasn't easy for me just go on the street and say, hey,
and it's never a competition. You know, we both own our own behavioral health, but it's never a competition. You know, we need to be out there and helping, you know, other people. So the main thing is to, you know, how did they do it? You know, how did Dr. Bigelow and Mr. Hall was able to pull this off, having those trauma that they have in the past?
Absolutely. And talk to us just as well as we had to reach out and talk to other people. You know, that's a start in terms of growth. But, you know, that's us constantly. I mean, it's going to be new people that we don't even know now that's going to be part of our journey that's going to enrich it just as well as we do others. But we just want you to know it's okay to definitely take opportunities to, man, to think outside the box and, you know, challenge yourself to grow. Like, really try to do something differently. Like, every day, the goal for me is simple. Like, I just want to be better than I was yesterday in some way.
Yeah.
Like, one thing I'm going to focus on, I want it to be better than it was yesterday. And it's not always the same thing.
So you're saying not richer?
Nope.
Everything.
Not richer. Not rich. Look, you have many disappointing days. That's what we set our goals off of. But yeah, we do. We have fun. We laugh. We joke. You know, this is a field where you can cry. You can do whatever you need to do, man, to find healing. But we really enjoy being around each other. We enjoy the stories of our clients. We enjoy just like that whole idea of family, the extended family that you create that is more than, you know.
Don't have to be blood.
Don't have to be blood for sure. Don't have to be blood for sure. So let's share some other things, you know, in the sense of this right here. With the holidays coming up, right? Normally it's a high time for stress, high time for depression, high time for all of those things that, you know, are negative only for one reason, that is constantly correlating. Like, you can really just look up the homework. It's constantly because people are worried about the things that they do not have.
Right.
They down because they can't probably provide for their kids, or they can't get what other people have, or they worry about the wrong things, right? I'm saying that they're the wrong things because honestly, what you should be putting your energy into is those things that you can control, right? Like, man, love, teach your family what love is. You can always be around each other. You know, try to do things that don't cost a lot of money. Even even people that have a lot of money, try to do things that don't always cost a lot of money. Family time, movie time, going on walks. You know, it's a lot of different places that do light shows and things of that nature. But let's talk about like that struggle that you have to constantly, we have to work to pull people out of because of that idea of worrying about the things that they can't control. Like, you know.
Right.
And
I think you pointed out that area of, I can't control. Yes, you can. You know, it might be a ruminating process in your head, but you can still have a level of control, and that requires accountability. Mr. Hall had mentioned to you going for a walk. That's accountability. You know, doing 20 minutes of exercise, that's accountability. Making sure that you're taking small strides. It doesn't have to be big. That's why, what do they call that at the beginning of the year? New Year's resolution never works. The thing is, if it doesn't become a routine, it's just a season. It's just a time that you just put in place. It has to be a routine. You have to constantly make strides and making sure that you're putting some effort into it. It's not easy. Believe me, take it from somebody who went through trauma, from both of us. It's not easy, but that's not what we're saying. It doesn't have to be, you know, a time span of a year and you're supposed to be okay. It's okay to not feel good that day because it's a reminder, but do something, okay? Just do something. That's what we're saying when it comes to, you know, grieving in the holidays. The holidays is for us to not only share, you know, with our immediate family, but do something for others. What about, you know, cooking for someone for Thanksgiving? I have done that many times during my bereavement process. You know, I don't have my family anymore, where my family was the center of Thanksgiving. So you know what I did? I went and volunteered and cooked and served that day. And I felt great about it. So there is always something that you can do in this time where it can be a very devastating moment. It doesn't have to be.
Absolutely. And that was another tip, you know, doing something. I mean, I've seen many things done. I know our family, we made donations in the name of our loved ones. We've came together and helped other families, you know, it's many different things you can do, man, to just kind of jumpstart that process and keep it moving. But understand, man, the holiday season is just about, love, man, and having family and friends and just that support. Because at the end of the day, man, I hate to really see people go in the hole knowing that when Christmas over, guess what? The 26th coming, them bills still there, and now you can't pay your bills. You know? Then
don't make it a Band-Aid.
Don't make it a Band-Aid. Like, let's make it like any other day. We need to be able to make sure you're living after these holidays and you take care of your bills and not put more stress on yourself after the fact.
Retail therapy is not always good. I love it. I mean, I'm pretty sure you do. And I love shopping for others, but at the end of the day, can I afford it? Again, it's not just a mental health, but physical health as well as financial health. You got to look at all of that. And at the end of the day, it all becomes mental awareness and mental well-being.
Absolutely. And because I'm going to have Ms. Carmelita, we're going to be doing so many things together. I ain't going to give everybody everything in one shot today for sure. But this is my chance to give her flowers. I mean, I appreciate her coming on the show. I enjoyed our time in college together. I've enjoyed being with you on the other side. With us both being licensed in the field, you going on to getting your doctorate, furthering that education. I give you opportunities to highlight your program, the college that you actually attended, so I can give them their flowers as well.
Oh, wow. Okay. Well, if I have to share this part, I actually wanted to just go with a university that I call it fly by night, and hopefully I could just go under the radar and get my PhD. Boy, was I wrong. It's the hardest thing that I ever have to go through. And I said, they give you 7 years to get your PhD. I'm going to do it in 2 years. You're right. No, I did it in, I'll have to say 3.5.
Good job. Congrats on that.
And I've seen some colleagues of mine that got to the point where, they didn't make it. They didn't, and I thought, wait a minute, I thought this college, this university was one of those that are easy to get. I was wrong. But anyway, kudos to Capella University, Capella U. They are K-Craft, and they have given me the opportunity to be where I need to be today.
Absolutely. And now, even after you've gotten that doctorate degree, what's still motivation?
What's the next motivation?
Yeah, what we chasing?
What we're chasing? Generational wealth.
Okay.
With all the people that we have been helping thus far, I think the motivation of this is really to continue sharing awareness for mental health well-being. It's very important. Just like when you go to your physical, yearly physical, it's also you need to do your yearly mental health check.
Absolutely. And then now that we're speaking on just those check-ins and we're wrapping up, how important, I know, I just want to give a plug because it's men's helps month, really just highlight things about men just from the mental health aspect, prostate cancer, any issues that affect men, but they also affect women. Right. So it's important to get those screenings. Yeah. It's important to go to the doctor and stay on top of things. If there's things in your family history that you need to know about, man, make sure you're getting those checkups. I spoke earlier on, just diet and exercise. We were talking about nutrition. Yes. But there's a lot of things in terms of just being a man. I'm a man as well. There's a lot of things that we can do to help ourselves, from eating better to working out to really just mental health. Just as simply as if our mental is not right, we're not balanced, and we need to talk.
We're not going to be able to get up.
Yeah, we can't do that. We're gonna fall by the wayside. So go seek the help that you may need. Definitely, continue to have connections, have fun, man. Get into some of your hobbies, and realistically try to analyze what has worked for you in the past. And if something is not working, be honest with yourself. It's not working no more. Let's find something else.
Move on.
Move on.
Move on. But just don't move on and not do anything. Think about your interest. Think about the things that makes you happy. Think about the things that perhaps you want to explore. It might not be something that is within your box. Think outside the box.
Absolutely. And that'll be the last information for today, man. I appreciate everybody for joining today. And check back in next week for the Chasing Your Dreams podcast for the next episode. but we continue to do that.
And hopefully we'll see you in the next in-person podcast.
Absolutely.